into a hypothesis.
The African landscape is changing. Despite decades of financial investment in healthcare, health outcomes in sub-Saharan Africa remain amongst the poorest in the world. For many, quality healthcare is inaccessible. The medical tourism industry is worth well over $1 billion, and fractured educational systems, inadequate job opportunities, and poor compensations contribute to a severe shortage of trained medical personnel. In Nigeria alone, it is estimated that approximately 2,000 medical doctors emigrate each year, with 80% of doctors within the country seeking work opportunities abroad. But what exactly is needed? Leadership. Strong and effective leadership.
Most doctors and other clinicians, as they progress in their career, tend to find themselves in leadership positions as executives without any formal training in what it takes to execute. From being a surgeon, all of a sudden you have to manage large budgets, you have to manage a diverse team of people who are non-clinical, and you find out that most people don't have that preparation.
The Healthcare Leadership Academy was established to support healthcare professionals unlock their leadership potential and develop the capabilities to drive transformative reform within their institutions. Our aim? To develop the next generation of healthcare leaders who excel in governance and service provision. Over the past 3 years, in Nigeria where our work has been piloted, we have trained over 250 healthcare professionals, from frontline clinicians to policymakers, and supported them to execute innovative change agendas within their workplace. Some of these projects have been run on a small scale in hospital departments, and some on a large scale involving whole regions. But all of these projects have sought to improve participants' job satisfaction and that of their peers and colleagues, person-centeredness within healthcare, the efficiency with which scarce resources are managed, and the design and management of processes.
I'm better off, I'm happier for attending the Healthcare Leadership Academy. And I would like to recommend this to everybody coming up in the healthcare profession, that this is a good course to go for. This is something that is highly needed, because like me, a lot of people feel that they are unable to be effective leaders, and this has certainly made a difference to me personally and to my practice here at Mercy Street Children's Hospital.
Leveraging on the knowledge gathered from the patient-centered care program of the wonderful HLA people, Healthcare Leadership Academy, we were able to do quite a lot of projects. Find those projects, not all the projects are capital intensive, so we should not be scared of the fact that, okay, if I go for this program, in fact, the amount they are collecting as a fee for the program, from my own perspective, maybe somebody somewhere is sponsoring them, is too small compared with what you are going to benefit from the program.
Our programs are context-specific and address the real-life and evolving challenges participants face in their daily lives that hinder their delivery of world-class care. Our faculty are accessible and relatable. They include thought leaders, academics, clinicians, public health specialists, and business leaders. They bring their wealth of industry knowledge and global and local solutions to bear in their development of cases and moderation of discussion-based learning. Our programs are affordable. We believe in equity and the democratization of knowledge. How else will we develop the critical mass of change agents that the continent so desperately needs? And we believe that within every healthcare professional lies a leader, and together, with the right skills, tools, and capabilities, they can be a guiding coalition for change. Be a part of our journey. Partner with us. Work with us. Lead with us. www.hlaafrica.org.
Hello, everyone. Good morning, good afternoon, or good evening, depending on your location. It's a beautiful day here. I hope it's a pleasant weekend for you too. It's my pleasure to welcome everyone to the conversation today. My name is Adedayo Falukman, a program manager at the Healthcare Leadership Academy. Today, I'll be your moderator as we delve into the topic, the role of effective board governance in building a stronger healthcare system. And on behalf of the Healthcare Leadership Academy, I want to especially welcome every one of you to the conversation today. It's a weekend. We're very much aware, and we know that there are a few other things you could be doing with your time at this time, but you decided to join the conversation today. So we appreciate that thoughtfulness that you've taken and the sacrifice to be here today. As we all know, the global healthcare landscape is currently being faced with lots of complex challenges, particularly in Africa and in Nigeria, where most of us are joining from today. We have issues around workforce shortages with lots of knowledge and human capital flying to the Western worlds and to find greener pastures. We also have shifting population health needs as well as demands for greater accountability, and at the heart of all of these navigating challenges lies the need for hospitals and even other healthcare providers to have effective governance. Now, when we talk about effective governance, it's more about it goes beyond just providing oversight, as you would find out from our very esteemed keynote speaker today. It talks about setting vision, ensuring that there's alignment with mission and other strategic resiliences that healthcare organizations need to be able to thrive. So today it's about just exploring and unpacking some of the key points that will help us set up effective board governance structures within our healthcare establishments that will shape decisions in a way that strengthens accountability and ultimately drive better outcomes for our patients and the communities that we serve. So it's again my pleasure to welcome everybody to the conversation today. Paul, if you can just put up our screen, I would like to take a moment to go through a few housekeeping rules. It's a Zoom platform, so please, if you're not speaking, if you don't have a question, kindly ensure that you're on mute to be sure we are not disrupting the flow of the conversations today. And then if you have a question, please feel free to use the raised hand feature. And then we can also put in our questions in the chat box and to be sure that, we're putting all those questions out there for our facilitator today to be able to respond to those questions. And if there's any other thing in the course of the conversations we look at in the chat box, I'll be happy to drop them right there. In terms of our roadmap for today, we're taking the introduction now. I will introduce the guest speaker in a moment, and then we will go into the keynote session. And to walk us through this session is our own esteemed speaker today, Dr. Ebes, who has been with the Healthcare Leadership Academy now for, I think, a couple of years, since 2023, I believe. Dr. Ebes, it's such a pleasure to always have you on the call. Now, for those of us who may not have met Dr. Ebes up to this point, she's the managing consultant at Bezalel Frontiers and the founders of the Student Founders and Entrepreneurial Platform, which is like a company that is limited by guarantee that promotes and advances business and entrepreneurship among student communities across the continent of Africa. Now she and beyond, and she was previously a lecturer at Covenant University, Nigeria, before proceeding for a resident postdoctoral research fellowship at the University of Johannesburg, South Africa. And she has worked in the Nigerian banking sector with the United Bank for Africa and Zenith Bank PLC for close to a decade before she moved into the academia. And before that, she's had a bachelor's degree with honors in accounting from UNN and an MBA MPhil, as well as a doctorate degree in management with specialization in business strategy from the prestigious Lagos Business School, Pan Atlantic University. Now, Dr. Ebes is a recipient of fellowships and awards from the Academy of International Business Africa, the Academy of Management, the United States, and the Business History Conference, as well as the Global Business School Network, a a network of leading business schools across 6 continents of the world. Our latest book on the sustainable development of African countries sort of explores how African countries can attain long-term development use leveraging their human capital. Ladies and gentlemen, it's my pleasure to welcome on board today to the conversation Dr. Ebes Esho, who will be leading us in the next 40 or so minutes through what it means when we talk about effective board governance, especially for healthcare organizations playing in Nigeria or Africa, and of course, beyond our continent. So, Dr. Ebes, it's always a pleasure to connect with you. Thank you for making our time to join us today. If you can hear me, you are now live and you can take it away from here. Thank you, and over.
Yeah, all right. Thank you very much, Dayo. Let me just put on my video. And so people can see my
Awesome.
face. Okay,
Yes,
so
I can see you.
okay. All right,
Yeah.
so Paul, please, you can start sharing the slide. I want to thank everybody for joining this evening, this morning, or this afternoon, depending on where you're joining from. So it's great to virtually meet everyone. Before, Paul, can you share the slides? Paul, can you hear me, Paul?
Yeah, it can. He's trying
Okay.
to share it.
It's
I
just
think
trying
we'll
to
start
share.
with the Menti poll as
But let's
you.
start with the Menti.
Mm.
I just want to take just to get to feel the room about what we think or see about the topic of today, relating to the topic of today. So if you're there with your phone, this is a time of tech and AI. So if you're with your phone or your laptop or your tabs, just put in go to menti.com and put in the code, and just to answer that question briefly. So if you are with your link, just put in the code 25296707, and let's just quickly see what we all think about the topic of today.
Yeah, just for clarity,
Okay.
for those of us using our phones, we might need to log into www.mentimeter.com.
Yes. And just put
The URL is already in the chat, so just click on that URL. It will take you there, and then you put in the code afterwards. So please, we would need everybody to just do that in a minute because it's important to get our inputs and perspective before we drive this forward. So click on the link there and then put in the code that you can see on your screen, and we will be able to get your responses. Thank you, Dr. Ebes. Over.
All right, thank you, Dayo. Okay, so I'll just let me share my screen a bit and just to see people's responses. Okay. Well, allow me share my screen. I just want to share my screen so everybody can see my screen, and we can can all see the responses.
Okay, I can see your screen now.
Okay, so have we all put in our words? Have we all put in our words? Have we put in our words? Has everybody put in their words? I can see three responses, okay? We can see responsibility, we can see succession, but the greatest response is to be sustainability. And so I can see oversight, accountability. Okay, great. And that's fine. So most people year-to-date thing, corporate governance is about sustainability, oversight, accountability, succession, responsibility. I see succession. Somebody just had a succession. So that's fine. So I'm going to stop sharing my screen now. And then Paul can share his screen again. And so Paul can share his screen again. So the most common word I saw was sustainability. Then of course I saw succession, I saw oversight, and but there was one word I probably was, and every word there is okay. Every word there is okay. There was one particular word I was looking for. I didn't find that, and I was hoping that somebody would put there board. I was hoping that somebody would put there board. So because the topic is effective board governance. But usually, sometimes people say corporate governance. Corporate governance is more common, but what is constant in this world, especially in this tech world, is change. And so I was hoping I'll see board. I didn't see board, but it's fine. So let's move on. So today we're just going to dive a bit into board governance for healthcare institutions. Before I go to the next slide, I just want to share a brief story. So some years ago, actually many years ago, when I was quite young, in the states where I grew up in. I grew up in Delta State. I grew up in a little town in Delta State in Nigeria, for those that are not in Nigeria. There was a hospital then that was so popular because the man was a specialist and it was a very good, it was the best hospital. It was known as the best hospital in town. And people used to jokingly say, if you take a patient, I keep the name of the hospital on if you take a patient to that hospital and that patient cannot be treated, then that means that hospital, there's no hospital that can treat that patient. I mean, that was just to show how good that hospital was. But after a number of years, of course, the owner of the hospital died. And I tell you today, if you go to the hospital, I would say it's a caricature of his former self. And a lot of people would wonder, why would such a wonderful hospital that was doing so well, that became so known, at least within the local community and environments, why did it pack up after the founder of the hospital, who was a medical doctor, passed on? And one of the reasons, we might find some of the reasons in today's presentation. So next slide, please. So we might find some of the reasons in when we go through today's conversation. And so for me, it's basically about board governance. Because the truth is that no matter how great the organization is, no matter how great the specialist is, especially if it's an healthcare organization, so you have great doctors, great nurses, the medical field generally, healthcare professionals, no matter how great they are, fine, they'll be great at their job, but if they don't have effective board governance, they're going to have issues. And one part of effective board governance is succession. And I'm glad somebody put succession when we took the general survey of the room. So when we talk about board governance, really, we're talking about management, direction, and control of the organization. So we are looking at, for healthcare organizations, they're looking at the governance, the management, direction, control of the organization. But those are big words. Those are almost like academic words. But it's really, there are a lot of structures and processes, rules, and best practices for you to be able to have effective board governance. Because board governance is not just having a board in place, which is one misconception people have. I see a hand there. I see one hand. I'm going to just give, I see one hand there. Is
Please, Dr. Ebes, we're
yes,
not
I was
taking
going, that's why I
question now.
didn't want
Just
to,
go,
that's why,
just
yes,
ignore.
yes.
Okay.
So let's go on. So when we talk about effective governance, really board governance, we are talking about it, like I was saying before somebody raised up their hand. When people hear board governance, most of the time they just think it's about having a board in place. But it goes beyond that. It's not just about having a board in place. You could have a board in place and still it's not effective. For a board to actually be effective, there has to be transparency, there has to be accountability, and they have to have strategic oversight. And so it's these three core things that actually make a board effective. And it's these three things that actually, because for a healthcare institution, for a board, for you to know that the board is effective, they have to have quality care. So board governance has to ensure that the vision and the mission of the organization is achieved. If that is not achieved, then you really do not have effective board governance, even if you have a board in place and all the composition of the board is in place. So for healthcare institutions, you have to make sure that there is transparency, there's accountability and strategic oversight for us to have quality healthcare. Because if you really do not have quality healthcare, then for an healthcare institution, then the board is not effective if you do not have quality healthcare. So Paul, please, the next slide. Another aspect of effective board governance is effective use of resources, better use of resources. And once you have a good, effective board governance in place, it helps to lower risk. It helps you to make better use of your resources. And of course, it helps to improve patient outcomes. And that's really, really key for healthcare institutions. Like I said, for you to have effective board governance, if you do not meet the vision or achieve the mission, if the organization is not able to do what it's supposed to do, then you definitely will have not succeeded. And so for healthcare institutions, having good quality healthcare and patient outcomes is actually very important. So what are the key governance elements that we have? And so there are some key elements of board governance for it to be effective. One of it is the composition. So even though I say that it's not just about the composition, but you have to know even how to have good composition. So one of it is the composition of the board. So that's really very important. How do you bring people onto the board? So do you just bring in only healthcare experts, for example? Or do you just bring in only family and friends? Or so making sure that you have the right people on the board is one aspect. It's very, very key to having effective board governance. Another one is to ensure that once you have the right people on board, you have to know how to make sure that they have both their roles and their responsibilities. Because as a board is another form of a team. As a board, it's a team. So what you really do have is once people come together in a team to work together, something that is key and very important is conflict management. And that's something that effective board governance also helps you to kind of manage conflicts. Because the truth is that you can't really avoid conflicts. It's almost impossible to avoid conflicts. So I always tell people that one of the earliest form of organizations is families. So biological families or whatever family forms, that's the smallest unit of organizations that we have in the society. And even within families, there can be conflict. So even when it's a family that consists of just a man and his wife, there can be conflict. And so knowing how to manage conflict is important to have effective board governance. And of course, the CEO and the board, how do they relate? The CEO is the one that gets involved in the day-to-day operations of the organization. But the CEO is also part of the board. So how does the CEO relate to the board? So that managing that relationship, the dynamics in that relationship is also one key element. And of course, like we said before, oversight and the composition are also very key. Next slide, please. Not minding what happened earlier. If anybody has a question, please raise your hand. So so that we don't mind what happened earlier and all that. So this is another practical example, apart from the story I gave, which is real, and this one also is real and actually more recent. If you're aware, in 2015, the government put in place a cardiac and renal center. It was commissioned in Bagada. Bagada is an urban area within Lagos State, and it was commissioned, and there was a kind of fanfare around, the commissioning and the facility itself, and it's a great initiative. So it was a very great initiative. But 4 years later, the facility was abandoned, overgrown, locked up. Effectively, the facility was no longer in use. And that's one of the things so what we can see here is that perhaps we need to look at the board governance of that hospital itself, because the truth also is that I always tell people that if you build infrastructure, no matter how great it is, if the people that are going to manage that infrastructure don't manage it properly, then there is no sustainability of that infrastructure. So I was very glad also that I saw that many of us in the room right now, when we took the survey, the word cloud on menti.com, most people's sustainability was what came, and it was out there, sustainability. Because one of the things that board governance does is to ensure sustainability. And when I say sustainability, I don't just mean about climate change and carbon and all that. That's part of it, yes, but I say sustainability also in terms of long term. Like the story I gave, if there was effective board governance in place, if the owner of the hospital had put in place effective board governance, most likely that hospital will still be able to retain the quality and the image and the brand that it had created for itself. But of course, they've lost it over the years because there was no effective board governance. And therefore, a healthcare institution, something that is very important for healthcare institutions is that you have to manage clinical practices, the clinical side of the healthcare organization, and other aspects of the organization. So what you find in healthcare institutions most times is that people think that the clinical things are the most important. And yes, they are really very important. But there are other aspects of managing a hospital or any healthcare institution that are also important. So we are not saying that the healthcare professionals are not important, but there are also other aspects of it that are really, really important. And that's one of the things that having an effective board governance helps to do, so that you're able to balance the finance, because an organization has so many units. If healthcare organizations have different departments, different units, so apart from the medical units or the units that relate directly with the patient. So there is a financial aspect, there are ethical issues to look at. And so all those things are what the board governance helps to, what the board, when they govern and provide effective oversight, they are supposed to look at every aspect of it and not just the clinical priorities. And of course, it's a priority for healthcare institutions, but financial stewardship is also very important. So that's why finance comes in, accounting comes in, and these are all aspects of board governance. Paul, let's go to the next slide. And so this is just so we can go to the next slide, please. And so, like, just a bit of what is the ideal board composition? What should be the ideal board composition? It should be people from different disciplines. Even though it's an healthcare institution, you should have the people from the medical field and different areas and specialties of healthcare institutions. But you also have And that's the people that are clinical. So you should also have financial people, people that are experts in finance, people that you should have a lawyer, there should be a legal representative who should be a lawyer, there should be community representation. So these are key components of board. And again, I would just say that when you're looking at the different people that you want to bring in on board, it's also good to consider gender. Gender balance is also very important. So I was speaking somewhere during the week, and during my speech, I made a statement and I said, there is something that when you just have, there's something that different genders bring. So what it helps to bring is people begin to see the same issue from different perspectives. And so the different perspectives actually helps to actually understand whatever issue is being looked at. And so it's also good to consider geography and sectoral diversity. Again, looking at all these aspects of bond composition, I must say, you realize that it can also depend on the size or the geographical location of the healthcare of the organization. So a global organization may want to bring in people from different world regions, while a national organization or perhaps just a local organization, at least in the current size of the organization, just local, they want to look at different aspects. So that's why I say it depends on the type of organization. Then one thing to also consider, of course, when they are doing the board charter, which you will get to know more about when we get into, when you do the main program, if you also have to look at the term limit. So people shouldn't be members of a board and just be members of that board all through. It's not a lifetime appointment. Let me put it that way. It's not being a member of a board is not a lifetime appointment. So it's very important. So that's why we say succession planning, even for whether you are even the founder of the board, is also very, very important. And one of the things I say with my story is that perhaps before the owner died at an old age, he could have looked at succession planning and just begin to step down as the CEO and step away from the board and just allow others. And then while he's still alive, he can groom them, but from outside, And so those are also important aspects when you're talking about board composition. Next slide, please. So there is governance, there is management. And so governance differs a bit from management. So what tends to happen is that the board sets the strategy. But like I said earlier, the CEO, who is the key man or the key person, runs the day-to-day operations. Even though he's a member of the board, but he runs the day-to-day operations. So day-to-day operations is like execution. So management is more like execution, while governance provides oversight. One of the things that boards may do is they can approve budgets depending on limits, they review performance from time to time, and they share compliance with the ethical codes of conduct they've put in place, and of course, the national and global rules that they're in place. And so something to keep in mind for healthcare institutions is that quality of healthcare is key. So that those are the part of the KPIs for the board of an healthcare institution. Quality of healthcare is key, finance is key, and of course, safety. So next slide, please. So how do you build productive and collaborative field board relationship? Because again, you could have a situation where, because the CEO is a member of the board, and he's the CEO is like the link between the board and the organization. It's a link because he attends board meetings and also participates in oversees the running of the organizations. So one way to ensure that relationship is smooth is to ensure that the roles are clear. So the roles of the CEO are clear. Another way is regular performance reviews And in clear roles, I will also say that it's written. It's good to always clarify roles in the board charter. The board charter should be as explicit as possible in clarifying roles. And of course, there should be periodic performance reviews and then reporting. And if there are ethical issues, for example, that if there are ethical issues or different risk issues, either in finance or in clinical areas, there should the way to handle those issues should be clearly written out in the board charter. And so, please, next slide, please. So, how do you handle conflicts of interest? Because one issue that comes up and is really important for effective board governance is conflicts of interest. So a conflict of interest is, so you have different people that we looked at earlier that are part of the board. So you have different people that are part of the board. How do you ensure that, you remember that these people that are part of the board, they also may have their own organizations that they are running. So they have either careers or their organizations that they are part of. So how do you ensure that there is no conflict of interest, such that the interest of the board members do not conflict with the interest of the organization? And so when we say conflict of interest, it's actually ensuring that the personal interest of the board members do not conflict with the interest of the organization. So one way is to ensure that there are board members are required to disclose when there are transactions, for example, that may lead or constitute conflict of interest that board members are interested in, and also the organization itself is interested in. They should be disclosed. That's how one way of managing that conflict of interest. There are organizations that will just say there should be no one at all. In fact, once the organization is interested in any area and a board member is interested in that same area, some organizations put a no to it. Others say it should be disclosed. And so that depends on the different contextual dynamics that are in play, and also on the board charter. Another way is, of course, there should be routine audits. So there can be routine audits, third parties. So you can have third party professionals. For example, you could have auditors and financial reporting professionals come in to audit the organization from time to time. Because essentially, because the board is not involved in day-to-day running of the organization, it's the CEO that oversees that. So the board can ensure that they bring in third party to audit the organization, such that it helps to kind of manage, one way of managing conflicts of interest. Next slide, please. So this is just a brief checklist for boards. So like we said earlier, there should be audits. And the one thing that boards can also do is to conduct board skills audits, to audit the skills set of board members from time to time. So remember that when the board was put in place, as time goes on, the different board members may either willingly leave the board, or there may be instances where the board members may have to remove one board member. And if that happens, for example, if a lawyer is a part of the board and the lawyer willingly leaves, or for whatever reason decides to leave the board, then of course we know that that very key aspect is now missing. So from time to time, there should be a skills audit of the board members, and then of course recruit any missing expertise that is discovered. The board charter should also, is actually very important that they actually publish performance KPIs. Most organizations do it yearly, some do it semi-annually. Some do it quarterly. There's no hard and fast rule, but what is important that it is clear and it is written. It is clear and it is written. And there's something that is become more recent is to also schedule off-site strategic sessions. It could be quarterly, it could also be annually. Most organizations do it annually. Some may do it quarterly, but of course, the board have to meet from time to time. So most boards may meet quarterly, but for performance reviews, generally it's 1 year, but there's no hard and fast rule. But what we're saying is that these things are really important. They are some of the checklists for boards to ensure that the board governance is effective. Please, next slide. So the key takeaways is for healthcare organizations, if you have strong boards, if you have effective boards, then you're going to have stronger health systems. I mentioned before, diversity drives better performance. Diversity in various, there's various aspects of diversity. And I must say that if you're in a country like Nigeria, where you have, on record, we say there are over 200 languages or 200 ethnic groups in Nigeria. And so one of the things that is important for a context like Nigeria is to ensure that even within the board, that different national regions are represented if possible. It's part of diversity. So diversity is quite broad. Diversity in age, diversity in experience, diversity in discipline, diversity in tribe, diversity in expertise. These are really important. So it's good to have diversity so people can look at the organization from different perspectives. And to ensure that roles, it's also important to ensure that roles are clearly written. That will be taken care of by the board charter. When you come for the full program, you see the board charter and the different aspects of the board charter and what should constitute a good board charter that will make for effective governance. And of course, there should be a CEO board relationship that is smooth. And when I mean smooth, we're really talking about trust. Because if the board doesn't trust the CEO, then there's going to be lots of conflicts. Again, that's why I said that that's why at the beginning we said composition is so important. Because what tends to happen in practice that doesn't make board effective, that the CEO wants to bring in family and friends. And not minding that the family and friends that you are bringing in may not be the right composition for the board. And so, and that I find that as a problem in this part of the world, actually. That's one problem in this part of the world. We tend to be, I would say, emotional. I will tend to be emotional when we want to do board composition. Things are changing and people are becoming more knowledgeable and realizing that for you to have a good organization, effective organization, for your organization to actually grow and be sustainable and perform well, you need to have a board that is diverse, that is really diverse. I go again back to diversity. It's really, really important. Then conflict management helps to protect integrity. One thing about conflict management is that I say that if things are clearly written and clear to everyone, it helps to manage conflict management. And especially if we have things in place that prevents conflicts of interest, we help to protect integrity and all that. And then, of course, there are different tools that we looked at. We talked about audits and charter. I kept repeating. So audits and the board charter, different types of audits, financial audits, clinical audits, different types of skill set audits. They are really important. So these are tools that the board can use to govern effectively. So this is just an overview. So I don't know if you have questions. If we have questions, anybody wants to have questions, you can just raise up your hand, either about the presentation or So questions, please. You have questions, any questions? Yeah.
Oh, thank you very much, Dr. Ebes, for that keynote. I was really scrambling to get notes down and some of the insights that you shared in the course of your conversation. Thank you again. For those of us just joining, the conversation today is the role of effective board governance in ensuring stronger healthcare, organization. So Dr. Ebes just walked us through some of the important points to note. And so please, if you have questions, raise your hand. Oh, great. I see a hand up. Or use the chat box and drop your questions. I will take them within the next 10 minutes. So Zoe, if I got that correctly, I see your hand is up. Please unmute and ask your question. Hello, Zoe. Can you hear me? You're still muted. Let me try to see if I can unmute you from here.
Hi, this isn't a question, but you have disabled the mute function, so no one can unmute
Yes.
themselves, and you've disabled the chat, so nobody can speak in the chat as you're asking people to speak. Yeah, I just wanted to raise that.
Yeah, I appreciate that. We had an intruder earlier on, somebody who wasn't supposed to be here, and we were worried the person might disrupt, and that's why we disabled. But I think it should be active again now. Paul, can you confirm that it's active now?
Yes.
Okay, please.
Okay, it was just
apologies.
fixed. Thank you.
Yeah, thank you very much, Zoe. And while you were speaking, Dr. Ebes, something crossed my mind, and I wanted us to see if we could address that while we wait for others to ask their questions. I've been part of an organization that had a board, just on the website. We have board members on the website. Diversity. We had people that had reputations from different sectors. We have the both genders well represented, the industry knowledge and all of that. But in a year, we never get to even get any input from the board members. No board meetings, no contribution from the board. The board doesn't, in actual sense, the board does not exist. It exists only on paper. What do you do as a person who leads an organization in that kind of scenario, where you've done the due diligence to bring in people that have experience across different sectors. Your board is geographically and even gender diversified, but they don't perform their responsibility, as you put it. So what do you do in that situation, Dr. Ebes?
All right, thank you. Thank you, Dayo. And so before I answer your question, I will just say that one reason, that's not the only reason, or one possible reason why that is when people are bringing people to their board, what tends to happen is that they want to bring in people with high profile. So people just concentrate on, oh, I want somebody that has high profile in the society, either nationally or globally. I mean, and because again, well, why that is important, but they don't understand that many times some of these high profile people, it's good to have them on board, but these are very busy people. So one of the things to consider when making of the board is, will these people have time for the board? If you really want to have an effective board, it's not just that you want to have names. So I'm not writing that off totally. It has its place, but then you have to bring in people that will truly have the time, because otherwise, like we saw, the organization will end up not being sustainable. So yes, you may get some benefits from bringing high profile people, but if they are going to be so busy that they don't even have time to meet, then obviously they won't be effective. So one thing I would say is that, what's the reason you're putting the board in place? What's the reason you're putting a board in place? So if you're putting a board in place because you really want them to provide that effective governance that you're talking about, and you want them to be effective, and you want the organization to grow, then it's not just about the brand and the image that the organization has online, that people go to the website and they see, oh, this person is a member of the board. But if this person is not making a contribution, then the organization is losing. And one thing that people need to understand is that even if you are the founder of the organization, if the organization doesn't do well or leave after you, you actually failed. You've actually failed. And that's one thing that in this part of the world we need to do better. We want to have organizations that have lived for 100 years, so that when the founders die, the organization continues, it's sustainable. So if you're really looking at the organization being sustainable, then that effective board governance becomes very important. But apart from that, even performance is important, that there is that oversight. It's actually very, very important, even for performance. Because as a CEO, you may think that you're doing a very good job because you're only looking at it from your perspective. So even if you're the founder of the organization, because your question tends to happen a lot of times when people are the founders of the organization. So if you are the founder of the organization and you're just looking at brand and the image, but you're also not looking at bringing different perspectives. And it's not just your perspective that is important. Perspective of your board members are important. And so it's really, really important that is taken into consideration. But then to directly answer your question, if that is the case and the CEO really wants effective board governance, CEO or founder wants effective board governance, there's nothing wrong with changing the board members. I mean, you can always change the board members and bring in new people that are really, that have the time for the organization, such that they're able to meet and really do what they are supposed to do. And of course, something else, and final thing that can be done, of course, is something you can perhaps put in place compensation. So that's something that could encourage people, even though there's a caveat though, but I won't go into that in the session. But putting in place compensation also but that's not the foremost thing, but it's something that could encourage people to also make out time to attend board meetings.
Absolutely. I think the question then would be, the question when you talked about compensation would be, people always ask this question, what's in it for me? Right? People are motivated by different things, right? For some people it's money, but some people it's the prestige that comes with saying, oh, I'm a board member of 5 hospitals across XYZ countries and things like that. But it's good to know your perspective on that. We have a couple of questions here right now, and I would like us to look at them very quickly in the little time we have left. How do you, and this question is from Ayodeji, and permit me, I'm not going that, I'm just reading out the names. I know that there are doctors and other professionals amongst us. So Ayodeji is asking, how do you choose board members for your organization, and how can you be sure of their interest in your business? I think this is very important. You talked about it, but apparently he didn't join. He joined a little bit later. Maybe you had talked about it before he joined.
Okay. All right. Thank you, Ayodeji. So one thing to look at is to ensure that we said that we should bring in people from different disciplines. But to your particular question, it says to ensure that their interests, before you bring people into your board, you also have to discuss with them. You also have to discuss with them and see what exactly are they bringing to the board. So this is practice now. You want to bring in somebody to your board, you have to discuss with them and to be sure that they really have the time and they are interested, that they can do it. There's no way you really can know that they are interested if you don't first of all discuss with the board. And I would say when you're discussing with them, you should tell them why you're bringing them to the board, what you think they can add to the board. That also helps. So, but if you bring in somebody to your board and you along the line you notice, for example, that person doesn't attend board meetings, which are some of the things that should be included in the board charter. So if in person does a whole year you have 4 board meetings, quarterly meetings, and the person doesn't attend the 4 board meetings and shows lack of interest, you may want to consider including, again, when you come for the program, you see some of the things to consider in the board charter. You want to consider including that as part of the board charter, that if you don't attend the board meetings for a number of time, the person the organization will reconsider the person's board membership. It's something to consider in the because even though you discuss and do all the things you say in practice, sometimes the person may even have interest when they join the board, but along the line they lose interest, and so then the organization will then have to look at how do we make this person become more committed, or how do we handle the situation. And sometimes you may just have to let the person leave the board. Especially
Absolutely.
if you just have to let the person leave the board for the sake of the growth of the organization.
Yeah, and Dr. Ebes, thank you for that response. I think one of the things that also jumped out at me when you were speaking is that typically you would expect that you will have performance appraisal for your board as well. It's not out of place to maybe once in a year review the performance of the different members of your board to say what value have these people brought to the organization and things like that. And like you rightly said, sometimes maybe at the beginning when your organization started, they had more time to be able to commit, but now they've moved on to higher responsibilities and things like that, and they're not able to commit that level of time. And so when you do the assessment, you can feel free to move people on, appreciate their contribution so far, and then try to move them on. To your question, Zoe, the session ends at 7:15. So we have about 15 more minutes to wrap this up, because there's an information session about the board governance program that will be starting in about a couple of weeks' time. And so the last question we'll take here, which you've answered partly, is how do you remunerate board members, if at all they are remunerated or compensated? And that's a question from Zoe as well as Ayodele. So I've combined those 2 questions. How do you remunerate board members, if at all they should be remunerated?
Exactly. I like the fact that you said if at all, because that's important. Because many board members are not actually remunerated. Some organizations may choose not to remunerate, not to provide any compensation for board members, because why organization? There is no hard and fast rule, really. You could compensate them, you could not. My advice is, if board members are really interested in your organization, then perhaps they shouldn't be compensated. Then again, it also depends on industry. So sometimes it varies across industries. So if the board members for a social organization may be different, compensation for board members may actually be different for social organizations and different from profit-oriented organizations, and it could be different for different industries. And so there's really no hard and fast rule. But generally, the practice is for board members, if at all they are compensated with a sitting allowance. And it shouldn't be, we want to ensure that it's not the compensation. Shouldn't be the motivating factor for being a member of the board. Right. It shouldn't be, because if compensation becomes the motivating factor, then you question their interest in the first place, because they are not employees of the organization. They are not employees. So compensation shouldn't be the motivating factor. That's why when you're bringing people onto your board, you should ensure that they really are interested in. And if somebody said, how do you know, like the earlier question, how do you know someone is interested? For example, you want to bring in somebody to your hospital. You could look at somebody that maybe you have a specialist hospital in a specific clinical area. You could look at somebody that is a veteran in that area, and the person's history has shown that the person is passionate about this area because of one or two things that the person has done. So such a person coming to your board is not coming to your board because of the compensation. It's coming to your board because they're passionate about what the organization is doing. And so those are the dynamics that come into play when you talk about compensation. My advice would be don't compensate, but if at all they must be compensated, just minimum compensation, really, because they're not employees.
Yeah, absolutely. Thank you very much, Dr. Ebes, for taking those questions, and Ayodeji, as well as Zoe, and every other person that has put in a question or two. Thank you for making the session very engaging. Before we go, in the next 10 or so minutes, we should be done here. We just wanted to share a bit about some of our programs that are coming up in the horizon before the end of the year. And so the first up, Paul, is the board governance program, which really unpacks some of the things that Dr. Ebes has talked about here, and even addresses some of your questions at a deeper level. Paul, if you can move to the next slide, that will be appreciated. And so the board governance program, like I said, will be starting in a couple of weeks' time. You can register for that program based off of your participation on this program. On this webinar today, you're going to get a 15% discount. And so if you take up the opportunity to, register for this program right away after this session, the link will be in the chat. So please register. And one of the things I was going to add is that you currently, you know your organization, the current realities in your organization. One of the things you can do for your board members to make them more effective, and the way you can also compensate them, for instance, if they do not have the requisite board knowledge to be able to perform their responsibilities, you can say, okay, there's this program coming up, and we would like, as a complimentary or as a way of appreciating your interest to provide oversight function for us, we would appreciate if you can make out time to attend this 2-week long session. And there are 6 sessions where we'll be talking about the difference between corporate and clinical governance, because most of the time, a lot of board members don't even know, especially the new ones, people that are coming into board governance for the first few couple of years in their careers. They've had maybe tons of years, decades of experience in clinical governance, but they do not understand the intricacies of corporate governance vis-a-vis clinical governance. So during this session, you'll be learning more about corporate governance, clinical governance, the difference between the two, and how you can structure your board to make it effective and enable them, empower them to perform both their fiduciary and non-fiduciary functions. And then there's a module that talks about financial management, which focuses on strengthening accountability for the healthcare organization. I was particularly interested when Dr. Ebes talked about there's a hospital you talked about that was established in 2015, earlier when you started your session, and you said after a few years down the line, they were non-existent. Some of those things could be tied to, not having a strong accountability system to manage their finances and things like that. And so during this session, you will be learning all of these things. We will also conduct a board assessment for your organization to see what will give you a checklist and some of the assessment tools that we use here at the Healthcare Leadership Academy for free when you register for this program, to just assess your board to see are we ticking all the boxes when it comes to how our boards are currently structured. And then, of course, there is the next program, which is the patient-centered care program. For, as you all know, you can have a fantastic strategy at the corporate level, but again, it's the people that are delivering frontline care to your patient that make the difference. I was sharing a while ago that my wife and I visited one hospital in Lagos before, I think about 4 years ago. And when we left that hospital, my wife had said she was never going to come back to that hospital. You don't want to know what happened. The reason was because the frontline staff that attended to her did not do a great job. And that is a lost revenue. And you can imagine the impact of that experience if my wife goes on to tell people within our network and things like that. And you can have situations like this, online reviews and all of that. And these things have tremendous impact on the financial and even long-term sustainability of your practice. And so the patient-centered care program is tailored for frontline health workers and will cover things like quality improvement, the principles of medical law and ethics, some of the beliefs and cultural intelligence, as well as communication ethics that needs to be put in place when you are engaging with patients. And so this program will be starting in October. It's going to run for 3 weeks, and afterwards they will have a 3-month capstone project phase where they will take the learnings from the capstone project and push them and begin to implement all of those ideas in their respective facilities. And so if you are a CEO of a hospital here, or you're a manager in an healthcare organization here, please ensure that you enroll all your frontline clinicians for this program, because it could be the difference between, you know, moving to the next level of your practice and not making that strategic move. And again, for people that are on this call, there's a 10% discount for bulk registrations from your hospital. The next program is the healthcare, I believe it's the healthcare financial management program. Yes, this is for people that are involved that make financial decisions within the organization, from accountants to admin, maybe your auditors and whoever is involved, and even the CEO, as well as the management staff that make financial decisions for the organization. So you'll be talking about fundamentals of accounting, not from an accountant standpoint, but the basic knowledge you need to know. We're not going to try to turn you into accountants. For someone like me, I'm usually very not very open to all of those nuances of accounting, but I want to know what are the difference when we talk about financial ratios, when we talk about profitability ratios, of liquidity ratios. How does this impact on the financial performance of an organization? And those are some of the things. And we have another amazing facilitator, Kelechi, who will be walking us through all of these fundamental concepts and how to manage and allocate resources effectively for our organizations and measuring financial performance within your healthcare. How do you know that your organization is doing well or is going to be in existence in the next 5 years? We will do some of those things, have those conversations in the course of the training. And of course, there is the strategic financial management considerations. What are the things you can begin to do to optimize your facility and the human capital that you have at your disposal currently, so that you can grow over the next few years down the line? So you want to take advantage of this program as well, and share the opportunity with all the respective officers within your practice that make financial decisions. And then of course, I think there's one more program before we wrap this up. Paul, is there? Yes. Okay. Yeah. This is one of what was some of our alumni are saying. She attended this program, I think, about 5 years ago, and she was heading one of the hospitals in Kaduna State. And then she says within a year and a half since she attended the healthcare financial management workshop, that the facility had recorded 100% increase in facility treatment, and their profit margin had increased, and they are taking intentional steps to minimize their losses. And secondly, she can now pick out accounting error even as a non-finance healthcare professional. This is the part of the HFM program that gets me excited. For a non-finance person, for you to be able to look at a financial statement and say there's something not sitting right with this financial statement, that we need to do a deeper dive. It's very, very important for you as a management staff, and of course for your board members as well. And so that's about it. Paul, is there any other thing I'm missing out this evening before we wrap this up? No. Okay, so on that note, I want to thank everybody for your participation, and special thanks again to Dr. Ebes for joining us today. It's been an absolute pleasure connecting with you today. And I look forward to, the program that is starting. And by the way, Dr. Ebes is one of the faculty that will be facilitating the board program that is starting in a couple of weeks' time. So for those of us that will be joining the program, you will have the opportunity to join, to connect with her again. Awesome insight, very vast experience that I can bet would add value to what you currently do in your respective facilities. The recording for this session will be made available. My colleague, Paul, will be working on that to get that to you sometimes early next week, Monday, probably. I'm sure that we can get it across to everybody by Monday latest. On that note, I want to say thank you once again for your time joining us today. It's been an absolute pleasure, and we look forward to welcoming you to the board governance program that will be starting in a couple of weeks' time. From my end and from the HLA team, have a wonderful rest of the weekend, and till next time, keep making impact in your respective facilities. Bye for now. Thank you.
Bye, everyone. Thanks for coming.
Thank you, Dr. Ebes.